Welcome back. We're going to talk hemodynamics. Hemodynamics can be defined as the physical factors that govern blood flow. It involves monitoring of blood flow using invasive catheters. Critically ill patients require a continuous assessment of their cardiovascular system to diagnose and manage their complex medical conditions. Allows for adjustment of treatments in more appropriate manner, and it provides continuous access for regular blood samples. So invasive catheters such as the arterial line, the central venous pressure, and the pulmonary catheter are used. The A line is, or the arterial line is also known as the A line. It measures systemic and arterial systolic, diastolic, and mean pressures. The A line preferred site is the radial artery, but can also be accessed via the brachial artery, axillary artery, femoral artery, and also via one of the lumens of the intra-aortic balloon pump, or IABP. Prior to placing an arterial line, an Allen's test must be performed. After insertion, be sure to check the pulses distal to the insertion site, because thrombosis or embolization may cause loss of the limb. The central venous catheter, also known as the CVP, is used to measure right atrial pressures or preload. It measures the central venous pressure as a mean. The CVP line is usually placed via a central line in the central vein like the IJ, or internal jugular, subclavian, or femoral vein, or is a port on the PA catheter, or pulmonary artery catheter. The PA catheter, also known as the Swan-Ganz catheter, measures the right atrial pressure, pulmonary artery pressure, pulmonary artery occlusive pressure, the cardiac output, and index. It is utilized when more information is required, such as left heart preload and cardiac output. Pulmonary artery catheters are indicated for patients with cardiogenic shock or congestive heart failure in the presence of respiratory failure to assist in improving oxygenation delivery, multi-organ failure, and when vasoactive medications and fluid management are essential for positive outcomes. The PA catheter can be placed into a central vein like the internal jugular, subclavian, or femoral locations via the central line. A PA catheter insertion is important to be able to identify the waveforms, or during the PA catheter insertion, it's important to be able to identify the waveforms as the catheter is being inserted, as well as during your shift in the event the catheter has migrated. Radiographic confirmation of the catheter tip placement should be done after insertion of the PA catheter. Besides monitoring hemodynamic parameters, these lines may be used for fluid and medication infusions. So the normal cardiac output is 48 liters a minute. The normal cardiac index is 2.5 to 4 liters. And hemodynamic response is the stroke volume, which is 50 to 100 mLs per beat. Our EF is normal is greater than 60%. And the normal heart rate is 60 to 100 beats per minute. The stroke volume index is 30 to 60 milliliters per minute, or per beat, m squared. Preload values, that's the CVP, is the normal rate. What am I talking about? The normal range for the CVP is 2 to 8 millimeters of mercury. And the pulmonary artery occlusion pressure, or PAOP, is 6 to 12 millimeters of mercury. The afterload normal values, SVR is 800 to 1200, PVR is 150 to 250. And to calculate your SVR, you can use your MAP minus the CVP divided by the cardiac output times 80. And then for the PVR, or peripheral vascular resistance, is the mean PA pressure minus the pulmonary arterial occlusion pressure divided by the cardiac output times 80. Okay, for your SVI, it is the cardiac index divided by the heart rate times 1,000. All right, and for oxygenation, your normal values are SVO2 is 60% to 80%, and the SCVO2 is 60% to 70%. All right, that's a quick rundown on hemodynamics.